Andrew.
Yeah, hi. I just wanted to give you an update you might not have known about. I'm a Brown University internist and epidemiologist, and took about 2 months, but through a series of Information Act requests, we finally got the Department of Health to divulge cycle threshold data for over 5,000 positive PCR tests. Now, the data are a little dated. They go basically from February to the end of June in Rhode Island. But it was pretty striking that, and I know you had some discussion about this last week with a laboratory director, I believe from New Jersey. And
he was a professor,
what we
professor
found,
at Rutgers, Dr. Mita, who's a professor at Rutgers.
Yeah, you know, and it was actually, I only got to listen to parts of it, but basically what your discussion with him and frankly what the literature shows was very consistent with what we found with these data. And why?
Well, let me ask you, Andrew, I want you to do me a favor. Would you email me? Because I want to make sure you are who you say you are. I don't want to just have people call.
I can send you the data. I can send you the data.
Well,
it's tabulated on an Excel spreadsheet.
No, that's fine. I just want, if you want to identify yourself, I want you to identify yourself to me. That way I know that you're actually an epidemiologist, not some guy calling in with some stuff. Because, but the cycle threshold is
you can look me up. I'm on the faculty at Brown. My name is Andrew Bostom, B-O-S-T-O-M.
Okay.
But anyway, what we found was that I don't know if you recall, Mike, some of the cut points that the doctor from New Jersey gave you, but what we found was that over 36% of the values, and again, this is a period of time when the pandemic was frankly worse than it is now. It included the period in March and April when ICU hospitalizations were much higher, certainly than they are. Deaths were much higher than they are now. And there were 36% of the cycle thresholds were above 33, and about 50% were above 30. So what this is telling us, Mike, is that there's got to be more transparency. Matt, I'm sorry.
Sorry. Okay.
There's got to be more transparency each day. Instead of just these alarmist pronouncements about how many positive tests there are, they need to present the cycle threshold distributions. What percentage are above 30? What percentage are above 35? What percentage more ominously are below 25?
Well, let me tell you, I asked the Department of Health spokesperson Joseph Wendelkin sent me the instructions for the major testing technology that they use in the department, at the state lab. And that instruction manual said the cycle threshold was 37.
What that's telling you, Matt, is that they're required to take it through 37 cycles. Now, the CDC has actually said that the lab should actually go up to 40 cycles. The point is, though, that there's a burgeoning body of literature which shows that when you compare the cycle threshold values on tests to simultaneously attempting to culture, which is a very laborious thing. No one's expecting you to do that for each person.
Right.
To culture the live virus. And there's a great review from the Oxford Center for Evidence-Based Medicine, which shows that effectively, by the time you get above even 30, it's very difficult to show evidence of live virus. Certainly by the time you get above 33.
Nick, put Andrew on hold for me, because I gotta run for the news. I gotta talk to him. I want to talk to him further about this, okay? Because this is very interesting stuff, and we're just getting started on this. I gotta run for the news.